everybody, welcome to the channel, Dr. B360. On this channel, I try to present information to you that is knowledge-based, authentic, and genuine so that you may utilize it for your benefit and hopefully some entertainment. Let's get started. Today, I want to answer a question I am often asked, and I was recently asked by a patient that was very concerned about it. What happens if I get into a major accident and have to go to the hospital while I'm on Suboxone, or any emergency situation where you need to go to the hospital, to the ER, and get emergent surgery maybe, or pain control. Pain control, that's really the issue, and I'm on Suboxone. What happens? And they were extremely concerned about this. Over the years, I've gotten this question many times. I've even gotten it online. So let me answer it for you today and dispel any myths and also give you some peace of mind. And this may also facilitate providers out there working in emergency settings or first responders, and it will help them out as well so they don't have to worry about this. So let's take a very extreme example, right? Let's say you get into a major car accident and you are on Suboxone, and ambulance, first responders show up. They even have to use, God forbid, jaws of life, get you out of the hospital car and get you to the hospital. And let's say for a variety of reasons, and this is very possible, you can't even communicate that, hey, I'm on Suboxone, okay? Let's just throw that in there. And let's even make it worse. Let's say that you are on 32 milligrams of Suboxone a day, and half an hour before this accident, you had just taken your last dose of the day, an additional 8 milligrams of Suboxone. So throughout the day and daily, you've been loading yourself up with 32 milligrams of Suboxone. You get into this car accident and you can't even speak. They get you to the hospital. So let's say you are awake, but you can't tell them you're on Suboxone for whatever reason, and you're in excruciating pain and you have 2 broken legs and en route. What happens? Well, even if you have just taken your last dose of Suboxone, even if you are, at the maximum Suboxone dose per day, even if you can't communicate with them, what's going to happen? So number one, let's just break this down. The idea of not receiving opiates because I'm on Suboxone and I'm on recovery, that doesn't apply to this situation. That's the first issue we want to discuss. It doesn't apply to this situation. It's not a relapse. It's not an episode of use. It's not, but hopefully, potentially, it won't cause problems with your recovery after you get through this bout, this episode where you need full agonist pain meds, okay? And the key to managing that part of this issue is to maintain communication and close contact as soon as you can with your provider of Suboxone. So let's say in an extreme situation, you've been on pain meds for a few days, you're in surgery, you're in the hospital, what happens? You just need to communicate that with your provider, and the two of you, and maybe them and the hospital team, can plan a discharge, and you need to immediately follow up with your Suboxone provider. That's that part, and that for most people isn't the most pressing question, but we just did answer the first question that I brought up, which is the issue of your recovery. Is it thrown out the window? Are you at a much higher rate or chance of relapsing or reusing again, or whatever you want to call it? And where that risk lies will be different for different people where they are in recovery. And the key to mitigating that risk is, as soon as possible, communicate with your Suboxone provider, your physician. That's that part. But what about the pain? Okay, so you can't communicate. You just took your last dose of day 30 minutes before the accident, 8 more milligrams of Suboxone for a total of 32 a day, and you've been on this, let's say, for weeks, for months, whatever, okay? Well, and you have 2 broken legs and you're in excruciating pain. What are the first responders going to do? They're going to start pushing full agonist opiates, whether it's morphine, fentanyl, whatever, okay? They're going to start pushing that. And we already discussed, well, you don't need to worry about your recovery. It's not an issue, a clinical issue at this point, because something else takes precedence and takes over that. That's number one. Number two, okay, they're going to start pushing. And you have to remember, this is a dynamic situation with time and events. And every minute that goes by, you actually already have a little bit of pain protection from the Suboxone on board, but I understand that's not going to touch much. They're going to keep pushing the drug. And as time goes, your Suboxone will naturally be falling off. And as you're going through this, and they see maybe you're not responding as much to, let's say, 2 milligrams of morphine, 4 milligrams of morphine, they give you another 4 milligrams of morphine, they might add a sedative in there, whatever. It will take effect in a short enough time where you don't need to really have this as a concern or issue. The other very extreme situation or case within this sort of picture is that you need to be intubated or you're unconscious, okay? And you're in this car accident, okay? What's going to happen there? Let's say you're not conscious, you're not alert and oriented, as they say in the first responder emergency department world. They're going to do their thing, okay? They're going to take care of your airway, your breathing, your circulation, right? All of these things, and address all issues, and then they're going to get under pain control. Now you get intubated, but you're going to get some probably Versed, propofol, whatever it is, and they're going to start pushing their pain meds. Number one, already by being unconscious, you already have a degree of protection from the excruciating pain from your traumatic injuries. Number two, even the drugs that they're pushing is going to eventually cause some amnesia. But more importantly, they're going to start pushing the fentanyl, and they're going to be monitoring from your vitals, from your maybe body movement, from the way you're bucking the tube that's down your throat, and they're going to increase sedation and add fentanyl, and they're eventually going to find out you're on Suboxone. But really, the point that you need to understand is in any of those situations, you will get the appropriate pain meds that you need, titrated up to the level that you need. And in the case of being unconscious and you're being intubated, there's even more safety margin if you've been on Suboxone or even just took your Suboxone recently and you're worried about that you're not getting pain control. Either way, you'll get your pain control, and every minute that passes, that Suboxone is kind of falling, or buprenorphine, that active ingredient, that's falling off of the receptors. I hope this helps and alleviates some concerns, some paranoid feelings, some fears of what if I get into a car accident and I am on Suboxone, or what if I get into some sort of a emergency situation where I need pain medications and I'm on Suboxone. In the case that you're awake and alert and you can communicate with these guys, well, you can just simply tell them, look, I'm on high dose Suboxone. I just took my last dose, so I'm going to need a lot more pain control. Please help me out. And I think nowadays, most guys, especially in those extreme situations, are going to be aiming to provide relief. I hope this information was educational. Don't forget to like and subscribe, and I will see you guys soon. Glad to be back. Take care.